It's not just radio, it's Rockland World Radio. RocklandWorldRadio.com.
Welcome to Creating Health, Mind, Body, and Spirit with the Advanced Health System and Dr. Davis. You can go to davisahs.com to find out more about the Advanced Health System. And now, the host of Creating Health, Mind, Body, and Spirit, Dr. Ken Davis.
And good evening, all. Welcome. We are live, and I'm excited to be back. It's been quite some time since we've had a live show. I've had a busy year with a move to a new office after 37 years in Ridgewood, New Jersey. We've moved to Montclair, right? Mm-hmm. And lots of changes, lots of teaching, lots of exciting things going on in our life. And I'm really happy to be back. And we have a great show for you tonight. I'm featuring Miss Kristin Donchez, who works with us at the Davis Advanced Health System in our Montclair office, and with a lot of exciting and new services in which we're providing in our office. And our show is gonna be all about that tonight. So in our email blast tonight, so those listening, if you're having weight problems and depression and hormonal issues, low testosterone, it's so big out there today, right? And female hormone problems, lack of sex drive, libido. The shows, especially, the libido one. Fatigue. Chronic fatigue, exhaustion. We have the show for you tonight. And Kristin is our functional medicine expert at our office in Montclair. And again, we're gonna go back and forth, and the phone lines are open tonight for your questions. Rich, what is that number?
That number for our callers is area code 845-353-2910. That's 845-353-2910.
So feel free to call us, and we'll do our best, or Kristin certainly and she'll do her best to answer your questions. And so let's begin. So, howdy. So, Kristin, why don't you tell them a little bit about yourself and your background, and where you went to school, and your experience, and then we'll go from there.
Okay. Undergrad work was in biochemistry with emphasis in biophysical chemistry. What's
biophysical chemistry?
The human side, physiology of biochem.
Got it.
Human.
The human side.
The human side of biochem. And then I went on and got my master's in physical therapy, where I started working with children for a nonprofit organization. And most of the children were really young, 0 to 3.
Right.
And then some kids up to 5. And then later on, I started doing older children up to age 16.
Right. So you've been doing the physical therapy for about 18 years,
yep.
Correct?
Yep.
So also, I know we're going to talk about there's a unique component, right, about what you do with your physical therapy practice, right?
With the holistic approach.
With the holistic approach to it.
Yes. Yeah.
Which separates you out. What are some of the conditions or types of challenges that you find with the kids you're working with? What are you working on?
I work with some very severely involved children that have cerebral palsy or Down syndrome. I've also done a lot with torticollis children. They have usually born with torticollis. It's a neck injury.
You have good results with that?
Very good. Very good.
Great. So There's a whole other thing. There's another thing that Kristin offers too in our practice in Montclair. So in your biochemistry component,
mm-hmm.
I know you've been involved with biochemistry and nutritional components, mm-hmm. and your assessment of blood work, and your interest in the functional piece of before this pathology that takes place, right?
Yes.
So this was right up your alley. Why don't you tell us, it's a great story as to, as you've been moving along, of how you got into, talk a little bit about Dan Kalish, about some of the work that you've been doing and kind of your mentor right now.
Right. I've been studying with Dan Kalish. We met him at a conference. And he's been doing this work for 30 years. So he has a whole program, online mentoring program, and then we meet with him as well, and an extensive background.
He's a chiropractor, right?
He is a chiropractor.
Okay.
Yeah. But strictly now he does functional medicine and has been doing it for the last 20 years.
So what do you think separates Kalish? Because there's a lot of people today that are doing functional medicine, and I know that I get all these emails every day and marketing pieces from this. This one's teaching functional medicine, and this one, and nutrition. And so, what do you like about him?
What do I like about him?
Yeah. His course.
Well, the course or him.
Well,
like his
and
approach,
his approach different than all the other people that you've been exposed to and studied under?
Well, his approach is based upon listening to the patient's complaints and symptoms, and then tracking them back, taking the client back in time to see what actually was going on and what caused the stressors in their lives that caused issues with their body systems, which then cause the symptoms.
So obviously the case history or the case assessment is critical as part of before you really get into anything else. Is that it?
There's 3 main body systems that we look at: the hormonal, which is the adrenals, thyroid, and female hormones; the GI system. So the gut and digestion and how that's being handled, and then detoxification, which is the liver. And so tracing back, looking at what their symptoms are, but tracing back to how long ago the first symptoms actually occurred. And they could vary, because you could have somebody that was, feeling really good but under a lot of stress.
Right.
And then because of that stress, it affected their adrenal glands, but they were still handling it all. But because it affected the adrenal glands, it weakened their immunity system, right? Immunity, most of the immunity is in the gut.
Right.
So then they picked up a pathogen or got a leaky gut or became food sensitive and had those kind of symptoms.
All stemming from
from the initial stressor, which was the adrenals being taxed. And then you have the adrenal fatigue come into play later on, because they're even stressed more by the GI infections or leaky gut or whatever. It just adds to it.
So for those people that are listening, why don't you tell them? I mean, most people may not even know where the adrenal glands are.
Your adrenal glands are on top of your kidneys.
Top of my kidney.
Yes, and they're the stress. What we think of the glands that regulate the stress response in people. So the fight or flight. When we're under stress, the brain figures that we're under stress and has the adrenal glands kick up a notch, and they produce cortisol.
Right.
Is one of the hormones that they produce.
Right.
And that helps us be ready for whatever's coming up. Quickens our response time, gets the heart going faster, slows our digestion. All that.
In that fight or flight response.
In the fight or flight response.
That's in cortisol. What's the other hormone that's involved?
The DHEA.
Explain that a little bit. What's that all about?
That helps. There's balance, so it's balancing out.
Because that's a big thing today. Everybody's taking DHEA, but then people hear about it, they say it's very good, and then they worry about it.
Well, if you take it in large doses, no.
Well,
okay, we're kind of getting ahead of ourselves.
Okay, I'm sorry. I'm sorry. It's been a while since I've been here, so...
Okay.
All right.
Okay, so the adrenal glands are doing their thing. There's body's under stress. They're cranking because the brain told them to.
Okay.
Right? And then the stress goes away. And so the brain tells the adrenal glands to stop, go back to your normal activity, right?
How soon after the stressor?
It should be once the stressor's gone and handled.
Well,
So
is
usually-
it 5 minutes?
well,
Is
no,
it an
right,
hour?
no,
Is it next
no,
day?
No,
Is
no,
it,
no, no,
when
no,
is
no,
it?
minutes.
Okay.
Should be minutes.
So it's minutes.
And then we have a long, supposedly, time to regroup and reset,
To recover.
to recover.
Okay.
Except that when we're stuck in traffic for, 60 minutes at a clip and getting stressed out about it, and then we
Right.
hit our job and are getting stressed out about that, and then we go home and things aren't the way we want them to be there either.
Right.
Our bodies are continually under stress. They don't have that long
Lag time?
recovery time.
Recovery time.
Right.
Lag time, recovery
Right.
time.
Right.
So-
So the brain is the one that tells the adrenal glands to stop, to go back to normal, right?
Right.
Should be. Except that takes sensitivity. They need to know what normal is.
Okay.
And if we're under stress for long periods of time continuously, the brain loses that pathway. It forgets what normal down here is because we're always up here.
How soon does that happen?
It takes time.
Right.
It can take months of stress. We're not just talking like working an 80-hour week once in a while. We're talking something's going on major.
Over and over.
Right.
But it all,
repeated.
again, a lot of those things, again, as you said, can be a trigger that goes back to the initial stressor that
Sure.
may have
Sure.
happened
And it's cumulative.
20 years ago.
Right, right. And it's not just emotional, mental stress. It's our diet, blood sugar
Right.
regulation or dysfunction's a big one. The body sees it pretty much the same.
Explain that a little bit.
Blood sugar?
Yeah, blood sugar regulation and how important the adrenals are for that. Or am I, are
Well,
we
no.
getting, right? Am I getting ahead of myself?
No, it's the dysregulation is a major cause of adrenal dysfunction.
I mean, due to what? Due
It
to the
causes stress.
dietary
Right.
components.
Eating lots of carbs, not eating protein. We get these highs in our blood sugar and then they drop, and that stresses the body out.
Okay.
Which affects the adrenals. They have to they have to get us out of that slump somehow, right? So they kick up.
So how does, explain a little bit then how, since we're talking about, weight and loss of libido and, all of these symptoms that it causes, how would someone say, okay, well, all right, so yeah, I'm stressed out and I've had these traumas in my life, but I'm eating this way and I'm eating pretty well, but I'm not able, how does, where does the weight component come in?
Well, with the blood sugar regulation that we were talking about and with the adrenals, the metabolism itself gets broken because part of the adrenal's job is storing fat as well,
Right.
Is with the response to what it does with the liver and other cortisol itself does.
So so when someone says, well, you have a high cortisol problem, is it a high cortisol problem that's causing the increase in the storage of fat? Or is it a low, or it doesn't really matter?
It
is it
starts
high,
out
low?
when it's high, but then it's continuing because it gets broken.
So it's true that there is a cortisol component as that adrenal that's
Right.
contributing to the weight gain.
Right. Right.
So
So you need
regardless,
to reset. You need to reset for the adrenals and get everything back, and you need to normalize your diet and take care of all those other lifestyle. Either find a better way to deal with the stress, get some exercise,
right.
work with the diet, because the diet could be, the blood sugar could be, a cause, but it could also be a result of the adrenal issues, right?
Where the blood sugar is being affected,
right.
regardless that they may be eating pretty well. Or do you
It
find
gets
that
better. It gets better once they're eating well, but most people aren't.
Okay, I was trying to give everyone the benefit of the doubt they were eating pretty well.
Okay.
But so,
I don't think most people are. Or we're eating on the run. We're eating,
well, okay,
you know what I
eating
mean?
on the run, right?
Right.
Okay.
Or what are we doing? We're grabbing waffles and eating them in the car, or bagels, or, on the way to work and school. And
Where did that come
good
from?
God.
That whole
Yeah.
thing of eating on the run.
it's,
Maybe we
We're
create
just-
our
we did.
scheduling process of life, which I think that we experience in the office is that we have our kids and everyone doing 85,000 things a day. We overschedule. Our
yeah.
life now has become the schedule of.
well, I've had many teenagers that are in stage. We talked about the adrenals. You have stage 1 is where
I want
you're
you to-
elevated, right?
Yeah, I want you to talk
Okay,
about
we'll
that in a
talk
minute.
about it
So
more.
hang on
But-
a minute.
we've been seeing teenagers, young teenagers,
Right, that
that are stage 2, almost stage 3,
adrenal dysfunction.
exhausted because, all the
So,
stress they're putting on themselves and their busy schedules and,
Which is, of course,
And their
why,
diet.
why we're seeing the rise of such degenerative diseases.
right.
So I know that Dr. Kalish, his big thing really is that he starts out in that adrenal component, right?
Generally, it's 95% of the time, it's the first hit. That's where the body is.
So the evaluation of adrenal dysfunction is a primary, and it's pretty easy to test,
is.
which we'll get
We
into.
have that, yeah.
We'll get into later on in the show. While we're on it, why don't you, since we're there, that'd be a good time. So why don't you talk a little bit about the 3 stages of what happens,
Okay.
and then we'll go
Okay.
from there.
So we talked about being under stress for long periods of time
Right.
and how the brain loses its set of what normal is. So then it believes that what normal should be is the higher levels of cortisol. So it doesn't tell the adrenals to stop. So the adrenals keep overproducing, functioning as hard as they can to keep going because they don't know they're supposed to be less. So actually during that period of time, a person might feel like they're handling the stress really well. I'm doing really great
Right.
with this working 80 hours a week and
Right,
juggling
right.
the family and all that. And they're feeling very good. So
You
what
mean that's the kind of the adrenal rush that
It
people
is.
have, and
It
they
is,
feel good on
exactly.
that. The
Exactly.
people that jump out of an airplane and have or jump off a cliff,
Right.
free skiing or
Right.
something like that.
Right. So it's starting to take a toll. That's the stage 1 of the adrenals.
Stage
You're
1.
you're overworking yourself. The adrenals are overproducing cortisol because they don't know what normal is anymore, and of all the
Okay.
stress. And so they're cranking, and you're feeling like you're handling everything until the adrenals are so taxed that they can no longer keep up at that pace. And then the cortisol levels start to drop, and the DHEA starts to drop.
So are both of those hormones initially in an elevated state in the first phase of it, or not necessarily?
Not necessarily. DHEA can start dropping right
As the
away.
cortisol stays high.
Yeah. Yeah.
And so what would be a classical symptom that one would begin to feel with that?
Generally, they're not feeling.
So they're not feeling
It's the
any,
wired. It's more the wired
They're-
or
they're
the
moving.
jittery sometimes, or easily set off. You could feel like you're handling everything, and then there's just one more.
Is that the people that go away? You ever notice that's the people that, say, boy, I can't wait to go away on vacation. And they finally go on vacation, and then
they
for
crash.
3 days they crash, they don't
Yes.
feel good, and they get sick.
Often.
Is that?
Yes.
Does he talk about
Exactly. Oh, yeah. I've
that?
done
And
that
then
myself.
by the time they feel better, they're ready to go home.
It's time to go
And they
home
need
and
a
hit it all
vacation
over
from
again.
the vacation.
Yeah. Yeah.
I got it.
Yeah. So anxiety also.
So anxiety is one. Okay.
Also, yeah. So then the adrenals are exhausted or starting to get exhausted, can't keep up with the cortisol level. The cortisol starts to drop. And that's when
Okay.
more the fatigue, the exhaustion, more the weight gain comes into play.
Mm-hmm.
Depression is another.
Why is that? Why do they get depressed from that?
Because of the effects on the neurotransmitters to the brain. And just,
I mean,
low energy.
The brain chemicals become imbalanced.
Yeah. Yep,
Okay.
they do.
What else happens?
Female hormone issues can start occurring at that point as well. So PMS or infertility.
Infertility problems. All set up by the adrenals, huh?
Yeah. Yeah. Most of the female hormone problems aren't isolated to that.
To adrenal?
No, they are. Like 95% come from the adrenal the causative factors, the adrenals fatiguing, and then you have the female hormone. You don't have female hormone issues usually in isolation.
What do you say? Say that one
Usually,
more time.
if you have female hormone issues, they're not in isolation. Usually,
Oh, you mean it's not an isolated
it's
issue,
not
it's coming from
right,
another
it's
area.
coming
Okay.
from something else. Usually the adrenals.
Usually the adrenals.
Right.
So does Kalish talk about, or in your studies, because I know what I learned, about why so many women, especially, let's say as they're getting older or closer, they're premenopausal or menopausal, have such a difficult time at that point?
With the adrenal, right. Well,
Because there's no, what, because everyone's in phase 2 or phase 3 exhaustion stage? Okay.
And precursors to the female hormones are the same precursor as what the body needs to make cortisol and the
Okay.
DHEA.
So again, go back and talk a little bit about what DHEA is.
If we think of cortisol as something that revs everything up, and help me out.
You mean,
It's a catabolic,
okay,
right?
yeah.
So DHEA
Is a
is
balancer?
a balancer.
It's a regulator, is that it? It's a regulator until it starts to,
Well, it drops before the cortisol starts to drop.
okay.
So then problems with inflammation, you see that even on a greater rise because the DHEA isn't there to balance.
To balance it out.
Right.
So you'll have maybe a normal cortisol component, but the DHA begins to drop.
Right. That's in stage 1. Yeah.
And that's in stage 1.
And then right.
Also, what's the big thing about, everyone's talking about this, it's called pregnenolone. What's pregnenolone
steal.
all about?
That is the precursor to cortisol, but also precursors to other hormones.
You mean is it a hormone or is it a hormonal, is it
It's
like
like a precursor, the body uses that. It's one of the stages. If you're starting the hormones, you start with cholesterol and it gets adapted all the way down and gets modified slightly. So
it's like if I was to use, it's like a substance the body has.
yes, within itself.
Pregnenolone. It's
Yes.
like, okay, I'm going to take this substance that I have and I'm
And-
going to make this out of it.
And
I'm
right,
gonna
so
make
it
that out of
modifies
it.
it, converts it into cortisol, converts it into other
Into other what? Hormones that the body
the
needs?
female hormones. Yeah,
Female hormones? So that sounds like pregnenolone would be a big deal.
it is a big deal.
Because if you don't have any, that's a
Then
problem,
you can't,
right?
Right.
So what happens then? You don't have any hormones, and then you develop all these.
Symptoms.
So what about we've only been talking about a female. What about in a guy? What happens?
There's that as well.
So he gets what? Low testosterone levels and things like that? So is really the answer?
Melatonin too.
You mean the
which
melatonin?
regulates your.
Tell everyone what melatonin is.
It helps with our sleep cycle.
Right. So I know a lot of people are taking melatonin, but then that's not necessarily, then it creates
Well,
a problem a little bit.
it can create a problem, but you're not you're treating a symptom. You're not treating the underlying cause.
So
which
they're
would
giving
be the
melatonin.
adrenals.
Right. Same with depression, right?
Yes.
It would make sense. So a
Right.
lot of people are giving an SSR or a natural product, and a lot of that could clear with balanced adrenal function.
A lot
Is
of
that
it clears with balance. You can also do the amino acids to help with the neurotransmitter.
What do you mean? You mean you can supplement
Supplement, right,
with taking more amino acids?
right, because they can cross the blood-brain barrier.
The essential ones or the non-essential? The essentials, but most of the
Well,
food.
5-HTP and drawing a blank.
Well, let's go back to the thing about the amino acids.
Mm-hmm.
Well, we'll come back to the amino acids.
Before we do that, let me give out chat room information.
Okay.
Okay.
I'd like to interrupt this program by letting you aware of a chat room existence by clicking on the left-hand side of our menu bar where it says chat room button. Just click on that and join the discussion. Also, once again, the telephone number 845-353-2910. Thank you.
So chat with us, ask us some questions. We'll be more than happy to see if we can answer them for you.
I never got to stage 3 either.
We'll come back to that. All right, let's go back to stage 3. All right, so
Okay.
we have the stage 1 where
High cortisol.
high cortisol and
Lowering
the
DHEA.
lowering of the DHEA,
Right.
and people feel relatively pretty good.
Right.
Then
Don't
you
realize they're as stressed, or
Right.
their body's being as taxed as.
And they're saying, "Oh, I'm fine. I only
Right.
need 3 hours of sleep," or that type of thing,
Yeah.
or and they may be drinking cups of coffee or pots of coffee, and they're okay, right?
Yes. Yes.
So then there's a phase. So that doesn't last for long,
It doesn't
right?
last for long.
So what
no.
happens next?
And then the phase 2, where the cortisol starts to drop, as well as the DHEA continuing to
So
drop.
what are they feeling then?
we talked about the being tired.
Fatigued,
Fatigued,
tired.
depression goes along with it, the weight gain, more of the weight gain, right? And then you can have sort of the other symptoms. Also, the gut immunity decreases, so that's when you can start picking up other issues with that as well,
Right, isn't that
like
that's
food
what-
intolerance or pathogens that normally we can fight off,
So these are when people get parasites.
like parasites and right.
What was I going to say? What's the big gut pathogen, bacteria?
Pylori.
H. pylori infections, right? Enterobacter.
And these are
Things like
things that
that.
normally, if we're healthy,
The body can
the
take
body
care
can
of.
take care of. You're sick immediately, you can have some distress immediately, but your body gets rid of it, right?
Right.
But when our immune system isn't then at top notch, then they linger.
So a lot of that. So a lot of that is really secondary to the adrenals.
Adrenals, right.
Interesting.
And gluten sensitivity is another big one.
You mean gluten sensitivity as a result of the change in the gut health due to adrenal insufficiency? Is that it?
We get a leaky gut, like it gets a little bit more porous, and things that are supposed to stay within the intestine
Doesn't.
Right.
Like a sieve. Or right, they get
right,
a strainer.
right.
They get strained through.
Right. Which can, then there isn't a good digestion either. And then you have more toxins seeping through and getting into the bloodstream
Right.
instead of staying in the digestive
So
system.
maybe
to be
it's not
passed
really
out,
always
and
that,
then it's onto liver problems because there's increased toxins.
So maybe it's not always, maybe it's not just that that people really become gluten sensitive. Not everybody, of course.
Not
I mean,
everybody, no. There are
But
some
that if
are-
there was healthy adrenal dysfunction,
Function.
adrenal function, that a lot of that would be
a lot
tolerated
of
better.
it. A lot of the food sensitivities.
Yeah, or all adrenal. See, also, I want to mention that that's an important. My experience over the years, especially as an applied kinesiologist, is that most food sensitivities and allergy sensitivities are adrenal based. So things again that normally we would not be sensitive to, especially in the change of seasons, seasonal allergies are adrenal based problems, and get better when the adrenals are fixed, right? Okay, go and stage 3.
And stage 3 is we're in big problems.
We got
Exhaustion all the time, kind of, yeah.
So where's it? What stage is the Starbucks person going to be in having a cup of coffee? At what point of the day? In what phase?
It could be a 2,
What time?
like in the middle of the afternoon.
Oh,
kind
like
of deal.
3 or 4 o'clock, having a
Yeah.
good cup of coffee.
Yeah, needing it.
So what about those people like are online at the Starbucks that are passing through on their way on the highway? What phase are they in?
All the time.
Well, you go by Starbucks and you
They're
see those
always-
cars
right,
that were
2 or
getting ready
3.
at 6:30,
Probably.
trying to get
Yeah.
get up and go in the
Yeah,
morning, right?
Yeah. It's like, right.
In your experience, because another thing that's talked about a lot is well, even before I go, let's just go stay on the 3 a minute.
Okay.
So when there's a phase 3, primarily the cortisol is decreased and the
Greatly.
DHEA is
It's very
decreased.
greatly. Yeah.
And
And so
then,
they feel like if you think about a car, like car guy, 4 cylinders, right? Most engine 4 cylinders.
No. Six cylinders.
Okay, 6 cylinders.
6 cylinders.
All right. So they're waking up on 3 cylinders. That's how they're waking up. That's how they're starting their day.
Even if they had 8 hours of sleep,
Even if they had 8 hours of
Okay.
sleep. Even if they had 10 hours of sleep.
they're waking up and
They're
they just
waking
don't
up.
feel good.
Right.
Sounds like the whole world.
It does. Well, think
They
about
all need
everybody's
they all need a
overwhelmed.
test kit. Everyone's overwhelmed.
Everybody is
absolutely. and
overwhelmed and overscheduled and not
over-
eating well.
nature deficient.
Yes.
Okay.
Okay.
So,
So what do we do?
No, I don't want to go
No?
there yet.
Oh,
Let's
okay.
let's stay with what's happening here. So we have this adrenal problem is secondarily affecting the gut, right? Creating what we call leaky gut and altering our immunity and our immune function and creating pathogens, causing weight gain.
Right.
Or the susceptibility, let's say,
right,
to
right.
to pathogens that the body would normally take care of. Creating changes in our biochemistry in the brain and what's called neurotransmitters.
And impacting the liver function, which also impacts with all the toxins.
So the liver's having a tough time
Liver's
flushing
having a
the
tough-
toilet, is
right,
that it? It is
right.
the toilet
It is.
that can't
And then,
flush.
right. And then a lot of the toxins are fat soluble, so they can get through the cell membranes and start affecting us.
In what way?
It can affect brain function.
So there's a lot of things, you know.
Yeah.
Interesting.
And all connected.
It's all connected, you know, like
All
the leg bone's
connected.
connected to the knee bone
Yep.
and the ankle bone and all of that.
Yeah.
So what else? What's available? What are we doing?
What are we doing?
Yeah, what have we been doing?
What we've
What do
been
we-
doing?
what-
well, okay,
how can we help
so
them?
How we help them is we
There's a
talk.
question here if you'd like to hear it.
Absolutely.
The question from Jenny, how do you correct? And how long with the right treatment would it take?
Okay. Should we go there first, or should we finish?
Jenny, I think we should try and explain to how
Okay.
we,
All right.
that
So-
what your protocol is, what
Okay.
you do first.
Interview the client, obviously. Need to know what the symptoms they're currently feeling are, when they feel, tracing back past symptom groups.
Right.
Okay.
So again, I'm sorry. Are you trying to, at that point, trying to pinpoint when
Pinpoint what was first. And it doesn't always have to be the adrenals that were first. It could be the gut. There could be they could be
Well,
gluten sensitive.
right. No, I
which
didn't mean that.
causes
I'm sorry.
Right, which causes all those kind of issues, which then
No, I didn't mean that. I'm
tax
sorry,
the
Kristin. I
adrenals.
meant that.
Okay.
Apart from that, do you try and assess when the major stress hit in their life? Is that important or not really?
it's good for a timeline to figure out how long it's taken
Oh,
to
how
get
long
to this
and how
point.
long it takes to repair it? Okay.
Yeah.
So, and you keep going in your assessment.
Okay. So and then so we try to backtrack and figure out which was the first system to be hit. Majority of the time, it is the adrenal system, and that's where you want to start. You need to get the adrenals healthy. You need to get your immunity back, at least starting to come back before you tackle the gut issues.
Do you ever go to the gut first?
Yeah.
Is it rare?
It's rarer, but it happens.
But you go there first?
Yeah. Yeah.
Okay.
And sometimes it's the liver. You have people with a lot of old mercury fillings,
Right. So heavy metal
Or
toxicity, things like
Yeah.
that.
Yeah. And again, that's rarer. I mean, usually it's the adrenals.
So
just
okay,
because of our lifestyle.
So you start at you start with your case history and assessment,
Right.
and then what's next?
There's a test kit if it happens to be the adrenals, saliva based.
Why is that? Why do they use the saliva?
To get the hormone levels so that they can check them stable versus and this,
So why wouldn't they use the urine? I know they use urine
well,
too,
you
right?
use urine for heavy metals. You use stool samples for the GI to get the see if there's pathogens. or
Right.
the yeast or-
If someone asks, why is the
They're in the saliva. And
why is the saliva more accurate, let's say, than the blood for an adrenal dysfunction analysis?
Well, what we're doing is looking at it 4 times during the day, so we can get the circadian rhythm.
Yeah, I think-
To see the rhythm.
Yeah, I think that's an
Which-
important thing that you
we didn't really
explained.
talk that much about it now, but that's the other mechanism for the adrenals, and the regulation would be if the stress was not an issue, we weren't in a stressed environment, we would normally follow the circadian rhythm, which is higher. Cortisol's higher first thing in the morning and goes and lowers as the day goes on.
Right.
And then it's at its lowest when we're getting ready to sleep, and it builds up
Should be at
overnight.
its lowest.
It should be. I said, no stress.
Okay.
Should be, if we were all living on
So the highest
nice little island
time,
somewhere.
the highest it is,
when you
should
first
be in
wake
the
up.
morning.
You should wake up and be
Ready to go, right?
ready to go and take on the day.
And then it's a little
And you're
less.
using your energy as you're going through, and it's lowering and lowering until it's bedtime, and that's its lowest point. Follows the
So, but then it may not be that. I know a lot of
No.
people have a reverse.
right. They have a reverse, or because of again, with the stress of life, that normal pattern gets disrupted.
Okay, so the first thing, so then.
So they're exhausted. We talked about that, having the lower, waking up tired, so lower
Right.
levels in the morning, right? If they have pathogen problems and the gut GI problems, often their cortisol is lower in the morning.
Okay.
And then often we see people who are so focused on their day and thinking and just rehashing and replaying everything at nighttime that their cortisol, they stress themselves out then, and their cortisol levels are higher at night when they
I
should
mean, it
be.
trips or something,
Right.
right? Isn't that what's called the reverse cortisol
Right.
level?
Yeah.
These are the people that clean their house at 1 o'clock in the
Yeah.
morning, right?
Wouldn't
When
know
they should be sleeping.
Mm-hmm.
Like
Or
America.
write manuals.
Huh? Or write manuals? Yeah, a lot of people do that.
So I can show you. You want to see?
Yeah, and I just want to get
Okay.
clarity for everyone that, so you're doing your assessment and you're determining from your assessment
What the primary.
which the primary system of those three systems are.
Right.
Okay, so then
Originating. We want to go back and start treating in that order.
Okay, so then
So
then
not
what
saying
do you
that they're just adrenal, they might have gut issues, but if we don't
do
take
you ever
care
do two? Do you ever check
Yes.
two systems at one time?
Yes.
What warrants that?
If their primary complaints are in both,
Oh, in both areas.
Right.
I would think most people complain of
lot.
those things.
yeah.
And people
Yeah.
complain about everything, don't they? Or no?
Some
in that
do.
level, some do, some,
Some
don't.
do.
So you determine this as okay, and then what do you do next?
And then we do the test kits, which are
Explain.
saliva based. So
Right.
we talked about that. With the adrenals, it's a small amount of saliva, and well,
So in the kit, there's
in the kit,
vials,
there's
right?
vials. Okay.
Show them what it looks like.
Alrighty. Vials. Do you need something to hold it against, or on the table?
On the table
There we go. And you actually only need to fill it up to like right.
to there, right?
Yeah, to like about
And
there.
I believe you're not allowed to have to. Are you allowed to brush your teeth that day or no?
Yeah, well, you're not going to brush them first for the first. You're going to just rinse your mouth.
Okay. Oh, for your first sample.
Right.
So you're not really brushing your teeth that
Yeah.
day.
What you're not doing is if you're on any hormones per se, we're not taking the hormones that day or for 3 days, like ahead of time.
So that's important to say that again. So
right.
say that again. When
Well, if we're doing the adrenal protocol and
Right.
already, like say this, we were retesting somebody and they had already been on the protocol and we're getting the precursor hormones, they're not taking them for 3 days prior to us retesting.
No, I'm not talking about retesting. I'm
Okay.
talking about when the first new pure person that comes in for an
Okay.
adrenal assessment, and they're on let's say hormones or
Well, adrenal-based hormones like that. If we're talking adrenal.
you mean a supplement or a medication?
I know.
I'm a little
I know.
confused.
I got that.
If a person comes in for an assessment and and this is the first time they've had an assessment, and you're going to determine that the adrenals are their primary system,
Well,
correct?
then usually they're not on the.
They're not on any. What you're talking?
Most often they're
you're
not.
talking nutritional support now. Is that it?
Nutritional support is okay.
No, the first time.
Right,
So,
yeah. Yeah.
Okay, so if they were on adrenals, let's say a person
Okay, say there
comes
was
in
a female hormone and they were on the pill. We would want them off the pill.
for that day or
Well,
3 days prior
no,
to,
that would be, they would probably start the month after.
even on a general adrenal profile.
No, not a general.
No, I'm only
This one-
talking
okay.
adrenal now. I'm not talking the hormonal test.
Okay.
The adrenal test,
No coffee.
no coffee.
If you're on, if they were on adrenal support hormones, we wouldn't be doing that.
Okay.
Okay. No coffee's a big one.
No coffee for the adrenal. Anything else that day then when they do the test?
It's mostly normal. You just, you do it before you eat. You want a clean mouth, but not brushed, just rinsed.
Okay. So it's done 4 times during the day.
Morning, noon, around
dinner,
late afternoon,
and then is it done at bedtime?
Yeah.
So it's done at bedtime, and then they send it into the lab.
It in. Yep. Nice little box. They just
Put
stickers
it
all
in.
there.
You have
they
a
just
thing.
have to,
Boom,
yep.
boom, boom, and
Send
the
it to
lab
the lab.
gets it.
Lab
So
gets it.
and then what happens then?
And then they send us a nice little report after they process it.
Why don't you show them
Well.
what the report looks like?
I don't know if we can.
Hey, Rich, can we get you back? We want to
Thank
show
you.
what the report looks like.
How do you want to do this? Up, hold it up.
So we get a report back.
And what it's showing, I'm sorry, I moved it. Is the top red line. This is following what we were talking about, the natural circadian rhythm. And we want to be close to the top red line. Between red and green is normal, but we'd like functioning to be high as possible. And you can see this person is yellow.
Mm-hmm.
So if they're up here, which we would like them to be around a 24 when they start in the morning, they're at 11. So that's your 3 cylinders versus 6 cylinders.
So already in the morning, that person
Already in the
is
That person
ready to
is-
go back to bed.
Exactly,
Got it.
exactly. Trying to read this. It looks like they're pretty close to normal, or the low end of normal for the noon and as well as the dinner time, 4 to 5 o'clock. But then they kick up over here and are higher than they should be. And that's exactly the pattern you were talking about. The person cleaning the house at 11 o'clock at night.
Mm-hmm. Or writing manuals.
Or
as
writing
you said.
manuals.
Okay.
Okay.
Yeah.
All right. So I'm just trying to read levels here. So this is, I think it's close to a stage 3. Yeah, close. It's a stage 2
So that's close
still,
to the
but
exhaustion
yeah,
phase.
Yeah. Yeah.
Very valuable piece of information we have
Yeah,
there.
and then here's a normal pattern.
Okay.
And again, this I think is a stage 2. Kind of hard to read backwards, but it's a normal pattern. It's just low levels, and their DH
So
is
they
it's
still
way
need
low.
some help.
Oh yeah,
Okay.
they're not feeling good, and the fact that the DHEA is so low, this one's like a 1. It should be close to a 10.
Okay.
So, and then here's another funky pattern, but this again, the numbers are the thing to look at. This starts out way low, stays pretty much low the whole day, and then
And then
shoots
it comes
back
up at night?
Yeah,
So that person doesn't feel good also.
doesn't feel good also. You look at this one though, with the DHEA is
Right.
at an 11.
And
This
it should
is
be where?
well, this is the tricky part. It should be around a 10,
Right.
but because the cortisol itself is so low, 21. Like
Right.
this person's actually right before the end stages of actual adrenal failure. Like the adrenals are doing a last ditch effort,
So is that why?
and that's why the DHEA is so
Yeah,
high.
it's interesting because. So it's almost
If
like
you
the
just looked at that in isolation, you're like, oh, they're doing pretty good. But you
But
look at
they're
the
not.
cortisol and like, whoa, no, this person is really hurting. Probably a bunch of other symptoms as well. Not
So
just
that
the lack
could be,
of
for
energy.
example, depression on that one. That could be
Oh, sure.
irregular menstrual cycle, bleeding, having a menses several times a month, those type of
Yeah.
things.
Yeah.
Interesting.
And then this is just another low one. Low. The DHA is on the way down with this too.
Interesting.
So that's what we gain from these. We can,
Right.
we can tell where on that
Yeah, it's
curve they are.
phenomenal.
And then
phenomenal.
we can see how they're no longer on the normal day curve as well. So not only the level that the cortisol is being produced, but the fact that they're not following what should be a normal daily rhythm.
Okay, so now you get
Okay.
the test,
So
and
now we get the test.
comes back, and
what we want to do is get everybody back up to this high line.
right.
So we use some herbs to help elevate the cortisol. We give them the precursor, that pregnenolone that you were talking about,
Right.
the DHEA, precursors to actually, in very small increments, to the physiological level, before you're talking about the DHEA and
Right.
and
Yeah, I'd like
concerns
you to talk
that.
about that because I know that some of these herbs are very, and that what Dr. Kalish
Mm-hmm.
recommends is that these herbs simulate the same, what is it,
It's a natural,
output?
it's right.
It's very
right.
close to the
It's
natural
close to
production
the natural
in the body.
production, and that's why we spread it out throughout the day in very small increments, because that's what the body
So
has normally circulating within its system.
Yeah, does he feel that that's similar to the concept of, let's say, bioidentical hormone, or not really? Does he talk
We
about
don't-
that? It's not really discussed?
Not as much. Not
Okay.
Not as much.
Just curious.
There-
But it's just the low dosage stimulates the body's, it's kind of to match what the body
right,
normally
to match
does.
what the body normally would
Makes
do.
sense.
So you're not giving somebody 10 milligrams of DHEA one time a day. We're breaking it up throughout the day. So it would be as if they were that normal
Right,
levels.
right,
Everything
right.
was rocking. Those would be what would be normally within the body. So the precursors are there.
Right.
So the adrenal glands themselves just modify them and go from that point, but they actually think that, the body thinks it's making it. So it's reestablishing what normal is.
Okay.
And
Got
then we're
it.
also,
In your assessment initially, do you monitor or chart their dietary habits?
oh yeah,
So that's
Yes,
looked
yes.
at. That's an important
Definitely.
concept.
their entire lifestyle, how they deal with stress, right? If they are
What they're eating,
exercising, how they're
exercising.
eating. Yeah, and if it can get to the underlying causes of the stress,
Right.
it might have been way back when, but they're still carrying those lifestyle
Right,
factors
got it.
generally through. The other interesting thing is when it gets this broken, that the brain to adrenal connection gets that broken, you can change your diet and clean it up.
It doesn't change until you
can
fix
be
it.
meditating and taking
Doesn't-
yourself out of the stress, but if that brain connection is lost until you actually retrain the brain what normal is,
Yeah, and that's done through the
and that's through the nutrition.
nutrition.
Yeah,
Hmm.
through the supplements and yeah.
So if someone was going to ask you, okay, well, I don't have these drops and I'm using, let's say you mentioned DHA, so would
Mm-hmm.
it make sense then to take a product 4 times during the day?
Not if they don't know what's going on within themselves.
Obviously. So let's say they did know that what was going on with the DHA, right, and they were to use not an herb of DHEA, and they knew, and it was a DHEA problem. Would it
They
make
could-
sense to give it 4 times during the day or not?
It depends upon their particular situation.
What do you mean?
Everybody's different.
No, I don't mean that.
I
mean-
don't know how to answer you.
So it wouldn't make sense. Would I? Well, if
It
you're
wouldn't
getting
make sense to me right now.
well, if you're going to give people DHEA, right, and they don't have the drop component, and there's a DHEA problem, right? What I'm asking is that would it make sense? You said it would not make sense to give the product once a day.
Oh, if you've determined that they
Yeah.
need, then the best bet would, yes, be
To give it those
give it
particular times of
throughout
the
the
day.
day so that it was right. So that it was more like what the body was.
Was
The body
trying
doesn't
to-
wake up
you're
and
trying
decide
to-
at 7:00 in the morning it needs to
Yeah,
make.
you're trying to match the
It's full-
body.
right.
Is what you're doing.
Right.
Got it. Okay. So, so what's the as Jen was it Jen? Jenny asked, what's the therapy? How long does it take?
Depends upon how severe and how long it's taken to get to this point. It's a relatively short-term fix, meaning it probably took them years to get to
Right.
being a stage 2 or stage 3, and we're talking 6 months to a year
Okay.
of building ourselves back up.
Will the
And at that point, then the body would continue until the body's reestablished to what normal is, and the adrenals themselves have been supported with nutrition supplementation to be healthy again.
Right.
And then we can back off. Then maybe they just need, a little bit of support, or maybe just some extra vitamin C or something to keep
Right.
the adrenals themselves healthy.
Are there
Or
people that
nutritional
need
support.
that, the people take those herbs, let's say, for years and years, or not necessarily?
Where's the one with the low DHEA? They were like at a 1. It's going to take a lot longer. That could take 2
Okay.
years.
So
That was really, or
Pretty
the
bad.
one that was really high, that she was right before that. I mean, that could
Right.
take a couple years, but it probably took 10, 15, 20 years to get to that point.
Hmm.
Yeah. Yeah.
Interesting.
But usually, it's not that long.
Um,
You are talking a 6 months up to a year commitment of taking care of yourself and building yourself back up.
What if people said, I have this problem, but I don't want to give up coffee?
You don't have to give up coffee.
Could they still?
Oh, for the day?
No,
for the test?
No, for in their lifestyle.
Oh, you don't
I'm
have
just
to
using
give
it as
up
an example.
coffee. Just moderation.
Can it be repaired with someone
Yes.
still drinking caffeine?
Yes.
Could it be repaired if someone still has alcohol?
If it's like not a regular overdoing
No,
thing.
obviously
if
it's a balance.
social balance.
It's a social thing. Because these
Right.
are the questions that,
Right. No, yes,
that we
you
get,
can.
right?
Yes,
Do
you
I have to
can.
give up this? Do I have to give up
No,
that? Do I
no.
have to,
Do you need to clean up your diet if you're a carbohydrate junkie and that's one of the main triggers, that's one of the main stressors that your body's seeing, but we
Right.
can help do that.
Do you ever find that once the adrenals become balanced, or that all of a sudden, it's almost like innately that they just don't eat those foods anymore?
Yeah. Yeah. Well, you're revaluing yourself too.
Say again?
You're holding your personal well-being higher.
Changes, because
Right.
it's almost like the vibration changes, right? The
Right.
level of health and well-being energetically.
Yeah.
Um,
It's getting people out of that pain and discomfort and all those symptoms that they're latched onto, getting them feeling better so
Right.
that they can do more.
so how often do you retest them?
Again, that depends, 3 to 6 months.
So every 3 months
Or every 3 to 6 months, depending upon.
what's going on?
Right.
You want to
And
retest
they'll see an improvement once we start the protocol, about 10% each month, building upon itself.
them? So they'll feel better. So they feel better, what, 10% within what period
Within
of time?
the first month, generally. Sometimes it's like you're not really sure. Maybe by the second month they know. Oh my gosh, yeah,
I'm feeling better.
I'm starting to feel, yeah, yeah. And then and the people that were you talked about the weight and
Right.
issues like that. I mean, right. If you're talking about one of the people in stage 3, they couldn't handle exercising a whole lot.
No,
I mean,
they don't feel like
they couldn't-
exercising.
Well, they
They're
couldn't.
exercise to get to the bathroom in the morning, right?
Right. But physically they could not handle it. So you
Okay.
get everybody feeling better, and they're getting better to the point where it's like, oh, look what I have energy for now. And then that starts building upon itself as well.
Right.
It all builds. It all
builds up.
built to get you to this point, but we can reverse it as well and use that momentum.
To keep going.
Yeah.
So
Definitely.
why don't you tell the audience, what does a test kit, what does an adrenal profile like that cost?
I want to say $180.
The basic one.
I think so. I think the basic one. I don't think this is the basic one. Honestly, I didn't have the price list.
Can I see it?
Yeah, this is
Maybe I know.
Maybe you do. This is the 5, though. This is the one with the hormones as well. The female and male hormones and the,
Oh, that's with the melatonin?
the melatonin
That's,
one.
I do know that answer.
Yeah.
That's $276
For the melatonin.
for the
and,
melatonin. I think the basic adrenal profile with the DHEA, right,
is
and
it
the,
200?
no, it was 150.
Oh. Okay.
So maybe it's not, maybe
Maybe
that
it's
one is
180.
17, maybe it's too
I
much.
don't know.
We
don't
have
know.
all that information in the office for you, but it's not,
We should have been, should
yeah,
have thought
it
about
is
that one.
not, it is not thousands and
No.
thousands of dollars. What is a let me ask you this question. I think so each profile or test kit
It's
has
different.
varying
Yeah.
price range, but again, it's not thousands and
No.
thousands of dollars like
No.
a lot of tests can run in, and plus you're not doing it every week or
No.
2 weeks or whatever. It's really,
and
so when you make these recommendations, also one of the things that I hear also is that that people go to these nutritionists or people that are doing all this testing, they come back having 15 different supplements or 10.
not
So
that many generally. No, I mean, I wouldn't go. If you're talking about somebody who the pattern itself is out of whack, the higher at night and then really low in the morning.
Right.
So you might be talking 4 or 5 products.
that's not a lot,
No.
and
No.
some of those are herbs, right?
Yeah.
Drop herbs.
The drops. It's the licorice root and the
DHEA,
DHEA and the
pregnenolone?
pregnenolone are actually wild yam, like modified.
Hmm.
And they're drops. So you just a little dropper in your mouth, swish it around for a little bit. If you don't tolerate that, you can put it in water. There is alcohol in that, so if
What is someone that has an
then,
alcohol
then
issue
there's sublingual tablets
that you can get? That's
that you can
important
give,
to say.
right? And with the children, since we were talking about the teenagers, 15 and under, we don't do the precursor hormones. We work with
You mean
building.
like pregnenolone? you
Right,
mean?
right. We work on building up the adrenals, giving them the support and regulating the cycle. So if they need the licorice drops, that's okay, or something to lower it at night,
Right.
we can do that. But generally with the younger,
You-
just stay
you
away
don't-
from it
stay
and
away
support
from
it
that.
otherwise. And they usually bounce back quick.
Very rapidly.
Yeah, again, as long as you can deal with the underlying.
How did Dan Kalish, did he always use the herbs, the drops, or it was just over a long period of time that he figured it out?
Over time, I think
Felt the best thing.
within the first 10 years.
Tried to figure out the most thing that matched the body. Is that
Yeah.
it?
Yep. Yeah,
It makes a lot of sense.
it does.
Makes a lot of sense. So, what else would you like to, we only have about 5 minutes to go. I do want to say this to the audience that's listening. Those that are listening into this show, if I'm going to give you a code, and if you call the office with this code, then Kristin will do your new patient intake and evaluation, which is a $425 value. There will be no charge. It's
Right.
complimentary, not the test kits or what's needed,
Right.
but your complimentary evaluation. So that code is 1952 is that code. So if you,
And you're honoring that for how long?
I don't know.
Oh.
What is it now?
It's the 21st.
I'll honor that to the 15th of September.
Okay.
Okay, so to the 15th of September, code 1952, call the office.
Gotta give the year.
Yes, you have to give the year. 1952 till September 15th, and you'll have your...
2013.
Oh, 2013.
You were stuck on the other year.
I was stuck in the other year. I'm sorry about that. We're very excited to have this. I've always done blood work, as you know, for many, many, many years, and but I like his approach very much, as I've investigated, tons and tons of things over the years. And I've seen the results with people already, apart from everything else that we do in the office. So really, everyone really,
Take advantage of that.
yeah, take advantage of the offer, and come in and find out what's going on and what you may need. You want to feel better. I mean, there's not a lot of people that we see initially that come in that have energy.
No.
Also, I do want to add one thing before we close. It's, again, getting back to that those that are listening, female, understand too that at the time of moving towards menopause, that when the ovaries are producing less estrogen, it is up to the adrenals to take over, says, okay, I'll take over that job. Now, since again, most are in a phase 2, phase 3 exhaustion state when there's less estrogen being produced, then that's
Adrenals
when
can't.
they can't do the job. So, you have that feeling, or you hit the wall, so to speak, and you go into menopause.
With a lot more symptoms or severity of symptoms.
Yeah, a lot of that. So,
yeah.
and again, as Kristin said, just to summarize, those that are suffering with infertility and depression and gut challenges, digestive, this is a very, really simple, it seems, very simple but very powerful approach to really looking at something that really, first of all, is fairly cost-effective, inexpensive, and not,
Well, you're
right?
treating the actual body systems. You're not treating the symptoms.
Yeah, exactly.
You're going to the core.
To the core of the problem.
Right.
And I just want to add before we end, when they take the, when you recommend your supplementation and nutrition, do you recommend that they get the whole 6-month course of, or that you know what I'm saying? You know what I'm asking you?
If they're coming in, if we're doing like a 3-month, we know we'll be in for 3 months.
So you try and get them to get
Yeah.
the whole 3-month supply or the
Yeah,
6-month supply
yeah.
or whatever.
Yeah.
That makes
Unless
sense.
they're,
So,
clients that we see more regularly. But yeah.
Okay, so tell them how to get in touch with you.
Call the office.
Call the office. Well, you have to give them the number.
973
973
744
744
7447.
7447, or you can certainly send us an
Yeah,
email
send an email.
at info at Davis, DAVIS, info at davisahs.com, and please look at it, and tell others that there is hope, and there is you can feel better, and you deserve to feel better every day. So great job.
Thank you.
And it was, I learned something all the time too, and that's what it's about. So we'll have Kristin back on at a future show talking about some other components, as she mentioned, liver dysfunction, other things that you can do, right, with functional medicine testing and evaluations and nutrition. So it was great to be back tonight, and boy, the hour, I think we're good, right, Rich? And it was great to be back, and we'll be back with a live show real soon. So I'm Dr. Ken Davis and Kristin Donchez, and this is Creating Health, Mind, Body, and Spirit, Dr. Ken Davis on Wednesdays night. Please check out our archives. There's over 100 shows that are there, and I look forward to seeing you again. Have a great week.